next we'll start some very important urological issue, the prostate. Okay, and now like recently news that Joe Biden has a prostate cancer and all, and prostate cancer is becoming one of the top 10 cancers in men. So keeping that in mind, so when you suggest that a screening for a prostate cancer at BPH, at what age you must screen, and what are the simple tests or simple examination where it has to be screened?
So as you told, prostate cancer is increasingly becoming very common in our country. But unfortunately, in our national program, there is no prostate screening test. But nowadays, routine health checks, which is done in all private labs, cover PSA. So ideally, we have to do screening for prostate cancer. That's a basic test called blood test called serum PSA, which needs to be done for all males over 50 years of age. So if the patient is having a higher risk of prostate cancer, if a family history is there, if a brother, father is having, then they have to start undergo screening from 45 years of age. The common ways of diagnosing or screening prostate cancer is by getting a simple blood test called serum PSA and to undergo digital rectal examination by a urologist.
So this what is the two things, no? Total PSA and a free PSA.
Yeah.
So which one is suggest to be more specific?
First thing we suggest is total PSA. Free PSA we suggest when there is a gray area between the PSA value. We call it as gray values between 4 to 10 as the gray area. In those scenarios, we suggest free PSA. But ideally, first test we prescribe is total PSA.
Total PSA only.
It should be ideally less than 4.
And in India, see, there are some category of people who frequently undergo annual health checkups
Yes.
to get a PSA covered. And there are some category of people, they are Sankatabandaga Venkataramana.
Yes.
Unless they have some problem, they never visit hospital and they think that everything is okay.
Yeah.
In such people, like you suggest like how often, once in a year or twice in a year, to go for a PSA or what?
So prostate cancer is a very indolent cancer. It won't give
And to be
symptoms.
precise, like unless they have symptoms, they don't
Yes.
come to hospital. So in prostate cancer have some symptoms, or some people can have without symptoms also.
Yeah, usually they don't present with symptoms. So that's what I was going to tell. It's an indolent cancer. Patient will not have symptoms till it has spread all over the body.
This is very
So-
important point to be noted.
Yeah, so ideally all men have to be screened over 50 years of age with a PSA. So otherwise, if we wait for the symptoms to appear, you may have reached a stage 3 or stage 4 prostate cancer where the treatment is palliative or supportive care. So rather than waiting to get symptoms, you ideally get screened after you are 50 years old.
So normally you say the PSA value more than 4 is significant.
Yeah.
So what is the value significant for a BPH, benign prostatic hyperplasia, and prostate cancer? Anything
So
specific value?
PSA is an organ specific test. It's not a disease specific. Means it doesn't differentiate between infection and cancer. So there lies the importance of clinical examination as well. So PSA can be raised in infection as well as cancer. So it has to be complemented with a digital rectal examination. PSA test alone will not make a diagnosis of cancer.
Okay. So somebody is having a high PSA, and the next step is to go for a digital rectal examination by a urologist.
Yes.
So after these things, suppose somebody is suspected to be having cancer. So instead of going for a biopsy,
Yes.
so nowadays there is multicentric MRIs.
Yes.
So what is your opinion on this, on your clinical experience?
So for PSA levels of more than 4 and less than 20, patient needs to undergo something called as multiparametric MRI of prostate. So with this, we will get an idea. It gives a score called as PIRAD score. PIRADs 1, 2, 3, 4, 5. So based on the PIRAD scoring, if it's 4 or 5, definitely they have to undergo a biopsy. Or if it's PIRADs 1 and 2, they need not undergo a biopsy.
Okay. So now the one thing is like you don't need to be scared about a biopsy. There are some cases you can avoid biopsy. You can diagnose it properly with the
Yes.
MRI also,
Yes.
MRI prostate also.
Yes.
And come to the treatment. Like that's the fear. Somebody is diagnosed with a prostate cancers. So suppose somebody is diagnosed in early disease. So what is the treatment options? And somebody died with a late disease, it already spread to the other organs. What is the treatment option? What is the prognosis?
So over the last 10 years, a lot of development has happened in the field of prostate cancer. So the ideal treatment in a very low risk, and a low intermediate risk is a robotic radical prostatectomy, which is a curative treatment. So this is for locally advanced and localized disease. For prostate cancer which have spread all over the body, usually it spreads to the bones and sometimes to the viscera. So in these patients, androgen deprivation therapy and hormonal therapy and chemotherapy based on the extent of spread are equally effective.
Okay. So where was the role of surgery will come?
So low risk and intermediate risk,
Surgery
has a curative role.
You've already advanced.
Yeah.
The surgery has no value, then hormonal chemotherapy.
Yes.
has some. So like what is the survival rate? How many years people will survive for that?
They usually survive once the curative surgery is done. They usually survive their lifespan. So as I told, prostate cancer is an indolent disease. It won't change the lifespan of the disease. Usually patients die of other conditions like coronary artery disease or something else rather than due to prostate cancer. Prostate cancer per se will not make the patient die. It's very rare. So usually patient live their full lifespan, and curative procedures like robotic radical prostatectomy help them to live their normal life.
Okay. So as a doctor, you're working in a medical hospital. So what are the preventive measures you keep telling your patients in terms of the screening, in terms of lifestyle, so that they can prevent prostate cancers?
So ideally, screening test is one thing which we have to undergo. All males over 50 years undergo a simple test called serum PSA. Meet a urologist, get a digital rectal examination done, have a very good lifestyle in terms of food habits, have a good diet, and maintain a healthy lifestyle, avoid sedentary lifestyle, and maintaining ideal body weight. All these helps.
So to come to my area, is there any connection between the diabetes and prostate?
No direct correlation.
No direct correlation. Okay.